Welcome back to our medical learning series. Today, we're diving deep into Parkinson's disease. Parkinson's disease is a neurodegenerative disease, resulting from the loss of dopaminergic neurons in the substantia nigra of the brain. Neurodegeneration means a progressive, irreversible loss of neurons, and in Parkinson's disease, it is mostly the loss of the dopamine-producing neurons in the substantia nigra of the basal ganglia of the brain. To understand the pathophysiology of Parkinson's disease, we need to briefly explore the function of the basal ganglia in regulating motor signals, which brings about movement. The basal ganglia are a group of nuclei that lie deep within the brain. These nuclei include the striatum, which consists of the caudate, and the putamen. Globus pallidus, divided into the internal and external subthalamic nuclei, located inferior to the thalamus. And of course, the substantia nigra, which includes the pars compacta and pars reticulata. There are two main pathways through which the basal ganglia regulates motor signals. The direct pathway, which is the excitatory pathway, and the indirect pathway, which is the inhibitory pathway. In the direct pathway, the motor cortex sends excitatory signals by glutamate to the striatum. The striatum then sends inhibitory signals by GABA into the globus pallidus internal and substantia nigra pars reticulata. These two releases less GABA into the thalamus. The thalamus, in turn, sends more excitatory signals, through glutamate, back to the motor cortex. These pathway then results to increased motor activity, which promotes movement. The substantia nigra pars compacta also makes connection with the striatum by the release of dopamine at the D1 receptor, which is also excitatory. In the indirect pathway, the motor cortex sends excitatory signals by glutamate to the striatum. The striatum then sends inhibitory GABA into the globus pallidus external. The globus pallidus external, consequently, sends inhibitory GABA signals to the subthalamic nucleus. The subthalamic nucleus, in turn, stimulates the globus pallidus internal through glutamate. The globus pallidus internal then releases more inhibitory GABA to the thalamus. This causes the thalamus to send less excitatory glutamate back to the motor cortex, leading to decreased motor activity. Also note that the substantia nigra pars compacta makes connections with the striatum by the release of dopamine at the D2 receptor, which is inhibitory. In Parkinson's disease, there is a gradual degeneration of the dopaminergic neurons in the substantia nigra pars compacta, which leads to a significant reduction of dopamine levels in the striatum. This disrupts the balance in the pathways, where the direct pathway is understimulated, causing a reduced movement initiation, and the indirect pathway becomes overstimulated, leading to an increased movement inhibition. Parkinson's disease is also distinctively characterized by abnormal aggregates of alpha-synuclein proteins found in the degenerating neurons. These aggregates are called Lewy bodies. The motor symptoms of Parkinson's disease develop when approximately 50% of neurons have been lost. These motor symptoms include 1. Bradykinesia, which means slow movement. 2. Rigidity, which means a stiffening of the muscles which causes resistance in the range of motion. There are two types of rigidity in Parkinson's disease: the cogwheel, which is the start and stop movement, and the lead pipe rigidity, where there is an increased resistance throughout the range of motion. Another symptom are tremors, especially at rest. It mostly affects the index finger and the thumb. These tremors tend to disappear during movement and reappear at rest. There are also gait disturbances. Generally, Parkinson's disease patients are at an increased risk of falls. The combination of these four motor symptoms is called Parkinsonism. Parkinson's disease also have other non-motor symptoms such as autonomic dysfunctions like hypersalivation and constipation, depression and anxiety, sleep disturbances, and cognitive decline, mostly in late stages. The exact cause of loss of neurons in Parkinson's disease is not clear, so most cases are said to be idiopathic. However, some factors could contribute to an increased risk of Parkinson's disease. Some of the factors include 1. Genetic factors. About 10 to 15% cases of Parkinson's disease are said to be associated with family history, with a mixture of both autosomal dominant and recessive inheritance pattern. Environmental factors are also thought to increase the risk of Parkinson's disease. Example: exposure to pesticides or other industrial chemicals, living in rural areas, as well as infections like encephalitis. Age is often seen as the largest risk factor. The mean age of the onset of Parkinson's disease is 60. However, 5 to 15% of cases manifest before 40. Parkinson's disease is also slightly more common in males than in females. The diagnosis of Parkinson's disease is primarily clinical, usually based on history and neurological examination. This is because no single laboratory or imaging tests definitively confirms Parkinson's disease. Some key diagnostic tools for Parkinson's disease include 1. A new set of criteria called the Movement Disorder Society Parkinson's Disease Criteria. This requires Parkinsonism, meaning bradykinesia, and either resting tremor or rigidity. And in addition to that, there must be 2 supportive criteria such as an improvement in symptom with dopaminergic treatment, or levodopa-induced dyskinesia. There is also a no-exclusion criteria or red flag criteria. The no-exclusion criteria could include Parkinsonian features limited to the lower limb for more than 3 years, or treatment with dopamine receptor blockers coinciding with the symptoms. The red flag criteria, on the other hand, could be a rapid progression of gait impairment, symmetrical Parkinsonism, or severe autonomic failure. Another diagnostic tool is the DAT scan, where a radioactive isotope is injected which then binds to the dopaminergic neurons. Followed then by a single photon emission computer tomograph scan. This is done to highlight areas of dopaminergic neuronal loss. The DAT scan is usually not widely available. Although Parkinson's disease currently has no cure, its symptoms can be managed to improve the quality of life. Medications are used to manage these symptoms, but they do not generally slow the progression. The goal of these medications is to increase the level of dopamine in the central nervous system. However, dopamine itself cannot be given as it does not cross the blood-brain barrier. So levodopa, a precursor to dopamine, is given instead. The issue now is that levodopa is broken down easily to dopamine by the enzyme, dopa decarboxylase. Therefore, an inhibitor, like carbidopa, is often given to inhibit this conversion, thereby increasing the amount of levodopa reaching the brain. Other medications used to manage the symptoms of Parkinson's disease, in addition to levodopa and carbidopa, include pramipexole, or ropinirole, which are dopamine agonist. They stimulate dopamine receptors. Selegiline, a monoamine oxidase B inhibitor, which inhibits dopamine breakdown. Amantadine, which enhances dopamine synthesis and reduces its uptake. Entecapone or talcapone, which extends the half-life of levodopa by inhibiting catechol O methyltransferase. However, they have been associated with liver toxicity. Initially, medications may treat the symptoms well, but as time goes on, there is less of an effect, and the on and off phenomenon may inevitably appear with the use of levodopa. Over time, the on phase, which is the window for controlled symptom, gets smaller and tighter, while the off phase, the window for rigidity and uncontrolled symptom, becomes wider. This change from on to off and vice versa can happen quickly, like the flip of a light switch. In patients who no longer respond to medication, deep brain stimulation could be an option, where a pulse-generating device, like a heart pacemaker, is placed under the skin, near the clavicle, with electrodes connected to the basal ganglia, to improve function.